And even when you send off for blood tests and they have scans and they come back normal, and you just say, well, everything's normal, there's nothing wrong with you, please don't shut the door then. You know, dig deeper.
Hey TID fam, welcome to season 2 of the Invisible Diaries. We're your hosts, Misty and Amber. I'm Misty from MistyBlueDream.com, a chronic illness lifer with Ehlers-Danlos Syndrome and a congenital heart warrior. I am a biomedical major, writer, mom, and advocate.
And I'm Amber from the AutoimmuneAdvocate.com. I'm a mom, health coach, advocate, and fellow chronic illness warrior. And together we created the Invisible Diaries to shed light on invisible and chronic illnesses through education, advocacy, and awareness.
The Invisible Diaries isn't just about sharing our story, but also including each and every one of yours. But first, a quick disclaimer. Any information discussed in this podcast is strictly our opinion and for informational purposes only. It is not meant as medical advice and should not be taken that way. Always consult with your doctor or medical team.
We know battling chronic illness can be hard, and if you find yourself or someone you love in crisis and need someone to talk to, you can call the National Suicide Support Lifeline at 1-800-273-TALK, which provides free and confidential support in the U.S. 24 hours a day, 7 days a week. Again, that number is 1-800-273-TALK.
Any cited resources mentioned will be linked on our website, theinvisibleidiaries.com. Now let's get started. For this episode, we discuss Jeannie Di Bon from London, a movement therapist specializing in hypermobility, Ehlers-Danlos Syndrome, and chronic pain. With over a decade of experience, Jeannie is also the author of 2 books and writes for the Huffington Post, The Mighty, and Thrive Global. She also presents for Ehlers-Danlos Society at their international conferences. Jeannie, please go ahead and introduce yourself.
Oh, thank you so much for inviting me. And yeah, that was a great introduction. I think you covered pretty much everything. But yes, I have been working in this population with the hypermobile and EDS communities for since 2007, so a long time now. So at the moment I have clinics where I see around 20 people a week with EDS or hypermobility or chronic pain. So I work with them in my studio, but also now with the current situation, obviously we're working on Zoom a lot as well. Absolutely love working with this population and formulating ways to help them basically move pain-free. So that's what I do. People come to me, they're in pain. You know, when you have a condition like EDS or hypermobility, chronic pain, we often become fearful of movement. So people have a lot of anxiety. Conditions like this also tend to have or foster a lot of anxiety. So you've got all of those factors impacting how the nervous system is working. So what we do is just try and reprogram the nervous system, try and reprogram how they move so that we can start to move pain-free and actually start to enjoy movement, because it's, you know, for a condition like ours, I mean, I have hypermobile EDS as well, which I didn't know until 2018. So a very recent diagnosis.
Oh, wow.
Yeah. So, you know, a good 35 years of issues before I got my diagnosis. Like many of your listeners, I'm sure, because sadly, this is, as Professor Rodney Graham says, and a lot of your listeners might have heard of him because he's an absolute hero. You know, he's only just retired, and he's 87, and he's only just retired. But you know, he was the man who said that no medical condition has been neglected in such a way as EDS, and sadly, that really, really shows in the way that patients are treated. And so, you know, your podcast and what you're doing to help spread information and make people feel part of a community, I think is really important, because it's something that we've sadly have been lacking. You know, we've been isolated, we've been scared, we've been not believed. And to bring that all together in a positive way is really, really awesome. So, you know, thank you for doing this podcast. I think it's brilliant. So and I'm so pleased to be here and be part of it.
We're so happy to have you. We're fangirling a little bit because people like you are the reason that we feel validated. It's providers that, believe someone when they're saying something's wrong. Yeah. So thank you for what you do because it's so important.
Good. Well, thank you. Thank you for saying. And, and I think it helps that, I've been there myself. My symptoms started when I was, 13, and basically escalated from there. So muscular pain started when I was 13, along with what I was told was IBS. And that was the end of it. Every time I saw a doctor, it was IBS. But then things just escalated and, I end up with a whole list of conditions and symptoms that nobody even bothered to join the dots. And, ending up in tears in my doctor's surgery because I'm just told, well, these things happen or it's normal or, and it's like, or asking me if I need counseling. And I'm like, well, no, I don't need counseling. I need help. I want, so I really, really empathize with a lot of what people are going through because I've been there myself. And I wanted to take that experience and make it into something positive. I was drawn to movement. It's really helped me. It's rehabbed my body and my mind. And I wanted to share that with people because, it's very, very powerful when it's done correctly and done properly. So, the negativity of experiences hopefully is turning into something positive. So, yeah.
Now, I have a quick question before Misty gets her question in. I know you're from the UK, so just explain to our listeners, is there a difference between a movement therapist and what the US has as a physical therapist, or is it similar or different?
I think your physical therapists are what we would call physiotherapists here. So they've studied physiotherapy. So I'm not a physiotherapist. So my background, I used to have a corporate career, actually. So I worked in human resources and I have a master's degree in human resource management and training. But when I had my children, that wasn't working out anymore. So I was looking for something else to do. And I was drawn to Pilates. So my background is originally Pilates, and I trained back in 2007 in Pilates. But what I do isn't purely Pilates anymore. So I did Pilates, but there was a number of things about it that I didn't think was suitable for my body. And there's a lot of things around Pilates which involves, sucking in the abdominals, bracing, forcing a lot of perfection, a lot of how it looks, and it has to be done this way. And, if you can't do it, you're not doing Pilates. And I'm like, well, I can't do a lot of it. Certainly at the beginning, it was like, I can't do a lot of it. So I started to look for other things and I started to study because I became so fascinated about the body and what it can do that I started to study biomechanics. I studied anatomy. I had the privilege to attend, human dissections to really see inside the body and how it really works and how it's connected. And I got really fascinated with pain science and neuroscience as well. So I studied that. I went to Harvard and did a short course there to really study neuroscience and pain science. And so I brought all of this together. And that then evolved into movement therapy because it's no longer just Pilates. I'm looking at so many different elements when I work with someone. And I don't stick to the Pilates repertoire, I know that people in pain aren't going to be able to do the full classical mat or jump on a reformer and do everything that maybe is expected. So how can we modify this, which is a great system? Pilates is great. It's what helped me find my feet and start to get on my journey to wellness. But how can I modify it so that it can help our community? And that's what I've done. And so it kind of evolved into movement therapy. Having said that, I get a lot of referrals and I work with a lot of physical therapists in America and also physiotherapists here. And I've been asked to go and educate them on what I do with the hypermobile community. So over here in London or in the UK, I go and I speak to groups of physiotherapists and occupational therapists because they're interested in how I approach dealing with hypermobility. Because sadly, probably the same as over there, there hasn't been that much education in the field as to how to treat hypermobility. And people think they know how to deal with it, and they don't. And, you know, a lot of people have had poor experiences, sadly, going to physiotherapy or physical therapy. And, you know, well-meaning therapists have maybe pushed them too hard, given them inappropriate exercises to do, and they've ended up either injuring themselves or becoming anxious about doing those exercises. So my whole philosophy was, how can I turn that around and make people not fearful, look forward to doing their exercises and actually get a benefit out of it? So my whole movement method, which is called the integral movement method, is what my programs are based on. So it really looks at the body as a whole. I don't say, oh, you've got a knee problem, so let's look at your knees. You know, we have to look at how the foot is impacting the knee and how the knee is impacting the hip and vice versa, and how that can travel all the way up into someone's neck, you know? So I really look at the body as a whole, as opposed to maybe a physical therapist that has, you know, a very disjointed sometimes view. That's one of the complaints we have over here, is that the treatments are very disjointed. You know, people look at, oh, your shoulder, or you've got headaches, so go and see this person, or go and see a hip surgeon, or go and have orthotics, but nobody puts the whole thing together. And I think that was what was missing. We need someone who will look at the whole body. So yeah, I think that's the difference. Sorry, I answered that in a long-winded way, but
no, I love that. I
hope that answered the question.
No, that was perfect. I totally agree, because as someone, of course, with EDS, you know, I have a million different specialists, and right now I'm seeing a pain management and I'm doing physical therapy. So my ribs will kind of pop out from the vertebrae or dislocate. Yeah. On a daily basis, and so when I go see them, they'll put it back in, and then I do a couple little stretches, and that's it. So even though I have SI instability and instability of else, that's like they only focus on one thing. So for my question, was that a lot of doctors will tell me, oh, you should do yoga, or, you know, they'll make a suggestion, and I've been doing yoga, and so this is like my third day of doing yoga, or my second, many attempts of doing yoga. This is like my third in a week. And when I did a pose, when I came back up, I had a severe vestibular episode where I was spinning, my heart rate, I had an adrenaline surge, and so that was it. It's been a whole week, and since then I get the spins anytime I lay down. So question for you is, when you have, what do you suggest for patients like that who are being suggested to do something that maybe isn't the body, or how to handle that?
Yeah. I mean, I'm a big believer in, you know, it's not the exercise itself that's wrong, but it's the approach to exercise that's wrong. I mean, in my movement awareness years, I used to do yoga all the time. In my 20s, I was doing yoga 3 times a week, and I was always in pain. I always had low back pain. I always had neck pain. But I didn't tie the two together because I had very little body awareness. I didn't understand anything back then. Now I can do yoga, and I really, really enjoy it, actually. I have no problem with yoga, but it's because I understand how to control my body, what I'm doing. I listen to my body, so I don't do things that, you know, maybe don't feel right. And I think, you know, it's all about finding someone who's actually going to listen. So, you know, making sure the instructor or the teacher will listen. And if they don't know about EDS or hypermobility, that's fine. But let's face it, most yoga teachers are hypermobile, because that's how they can do all those amazing things. But, you know, are they willing to listen? Are they willing to learn? It's about, you know, not being pushed into doing stuff that just because the teacher tells you. It's having the confidence to say, actually, no, I'm not going to do that today because of whatever is going on. But it's really about, as I say, finding a way to understand the body so that you can go and do whatever it is you want to do. So, some people like to do yoga, Tai Chi, some people like to play golf, and I want to help people be able to go and do what they want to do without being fearful about it. It's tricky because, in a class environment as well, you have the pressure of everyone else is doing it. They can all do headstands or whatever. Why can't I do a headstand? I'm just going to try and do a headstand.
Yes.
And then it's like, should I be doing a headstand? So part of your brain's going, oh, should I be doing this headstand? Am I going to get neck pain afterwards? Oh, dear. And then the other half of you is going, yes, let's do it. Everyone else is doing it. I can do it. So you've got this sort of internal conflict going on. We're kind of beating ourselves up. And so part of your nervous system is not even happy doing the headstand. So you've got a conflict to begin with. Okay. So part of your muscles are going to be tensing up, going, oh dear, this isn't a good idea. And then your ego is going, yes, it is. Yes, it is. So, we've got to make the thing I like, or I really try and do with people is make them feel safe. So before we launch in and I, get them doing stuff, we really settle them down. So the first two principles of my movement method for hypermobility is breathing and relaxation, because if we don't relax and calm and feel safe and secure, any exercise I give you probably isn't going to work, because your part of you will be going, oh, I've tried this before and it hurt, and oh no, I don't. All of those little thoughts are going on in the background, and we might not even be aware of them, but some part of your brain is listening and going, and that's causing muscle tension. So if I say to you, oh, well, lift your arms up and bend over and twist, and part of you's going, oh no, I don't want to do that. So first step, breathing, relaxation. Then we move on to improving proprioception, improving stability, but it's a journey, and it should be a very gradual journey. With some of my clients, they're so tense and anxious when they come in that the first session we work on breathing, and that can have huge changes. Just getting someone to lie down, feel their breath, feel the weight of their body. I've had people burst into tears because they've been holding so much tension.
Oh, wow.
I've had people come back the next week and say, wow, I feel amazing. And we haven't done any exercise yet. Yeah. Because when you start to calm that nervous system down, amazing things start to happen. And you start to recenter yourself, and you start to find balance in your body, which I think a lot of us have been lacking, because we do live. I firmly believe, and I talk about this in my probably in both books, but certainly in the first book, is how we live a lot in our fight or flight system. I firmly believe that we're so, like you were mentioning earlier, adrenaline surges, we live in that high anxiety state, and that causes a lot of tension. And then if you launch yourself into a yoga class or a Pilates class on a reformer or something like that, probably we're not in the best place to be ready to do that. So I think it's a very gradual thing, very individual, obviously, to each person. And the one thing I would say to people who are listening, when you're starting out, I highly, highly recommend having like a one-to-one session with somebody, a teacher or a therapist, rather than going to a big group class. You really want someone who can look after you, who can look at what you're doing, give you a few tips and pointers. So obviously, for everyone, they can't always afford to have one-to-one sessions. So maybe a class environment is better. But if you could just have that first session where someone really gets to know you a little bit, I think it will really improve your journey as well. Yeah, because classes are challenging.
And even just maybe if you do a class, letting the instructor know ahead of time, hey, I do have some limitations in my body. So, because sometimes that's the problem too. If they don't know, they're like, come on, do that. You can do that.
Yeah.
And then you're like,
absolutely.
On the spot.
Yeah, absolutely.
And that's the thing, I've heard of, certainly in the Pilates world, but I'm sure it happens in other disciplines as well. People see that you're hypermobile And so they do say to you, oh, come on, you can go a little bit further. You can do more. You can do more. And so we end up contorting ourselves. But, I say just because you can doesn't mean you should, right? Just because I can bend over backwards or I can lift my legs behind my ears, I can't do that. I've never been able to do that, but many people can. Doesn't mean we should. Yeah, it's not right. So the thing that I do with people is really reduce their range of movement so they start to feel control of their body. Because if we're really bendy and we're doing all these amazing things, are we really in control? Not saying you can't ever do that again, but can you do it from a place of control as opposed to dropping into these amazing postures that are so easy for us?
Mm-hmm. Very true.
Yeah.
So yeah. I love what you said about movement therapy focusing on the body as a whole, because I'm married to a chiropractor, and chiropractors in that field, that's what they do. They focus on not just one system, but how the body works kinetically.
Yes.
So with that being said, and keeping in mind that everybody is very different because our bodies are different, have you noticed any specific alternative modalities that work well with movement therapy, like acupuncture or cupping or physiology, any of those things?
Yeah. Like you say, I think I obviously see a lot of people. So I see a lot, 20 people a week. And then I have my online program. I have the Zebra Club, which is a membership site. So we have hundreds and hundreds of members in there. So I get to hear a lot of things, which is great. So I know that people try lots of different things, but everyone is different. So there is no one fixed rule. Oh, you must have this or you must have that, because we all respond differently. So what I do believe and what I think is true is that people who, and again, some people might say, no, I love that. But in general, I think things like deep tissue massage is probably not a good thing, because we know that destabilizes the joints and people can feel quite uncomfortable after having deep tissue massage. But again, as I say, someone might be listening and saying, well, actually, no, I love that. I personally love osteopathy. Do you have osteopathy in the States?
We do, but I think it's a little different here.
Okay.
My friend works, but she's in Alaska. She works at one, so I don't know.
A lot of our doctors of osteopathy end up practicing kind of like mainstream medicine here.
Right. Okay.
They don't. There are some, because of course there's always the outliers.
Yeah.
Most of them are mainstream medicine.
Okay.
So our chiropractors here are more probably what osteopathy.
Okay. Yes. Because the osteopath will look at the whole body as well. So I love when I have headaches. Headaches is one of the things I have sometimes, not so much now, but cranial sacral work is really nice because it's very gentle. So any kind of myofascial work where you're not digging deep and disturbing the system, I think is really, really beneficial. But there's so many different combinations. People do acupuncture. Over here, people do physiotherapy is really popular, or physical therapy. Osteopathy, chiropractors. But there really isn't one rule, I don't think. Some people try things and they have really bad reactions to them. And yet someone else will try it and they go, no, I love that. And so
it's so true.
It's so tricky. So I really think each person will find a way that works with them. Like some people love yoga and some people don't like yoga. It's really odd, but I haven't found over all these years one set formula. And I don't think we ever will, because all of us are so different. The three of us here will have all different symptoms. If we wrote down our symptoms, they'd probably be very, very different, and how we feel will be very, very different. So how I respond to a treatment is probably going to be different to how you would respond to a treatment. And of course, you've got all your emotions and your hormones and all of that coming into how you respond to a treatment. So, I don't have a definite answer for that, but I think it's cool that we.
I love your answer though, because I think it's so important for people that are in a practitioner state to say that this is not the only way.
Yeah, nothing is a one size fits all, and I feel like a lot of times, especially here in the US, the physicians kind of apply a one-size-fits-all for everyone. So it's good to reinforce that.
No. In my experience, that's never going to work. A one-size-fits-all will never work because of the nature of EDS and HSD and hypermobility. It's just, every client I see, and you think how many people I see every week, every single lesson I have with them is different. Every single movement therapy session is different. So I don't have a set piece of paper where I go, okay, we're going to do this, 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 and this. It just would never work. Yeah? I couldn't. It would never work because it depends who's walking in the door, how they're feeling today, what's going on for them today. And you have to put all of that into the mix and then go, okay, what does this person need today? How can I help them today? And that might be different next week. They might be totally different next week. So you can't plan your lessons when you're working with the chronic pain or, chronic illness community. You just can't, which is great because it keeps me on my toes as well. And I'm learning all the time from my clients and my patients. I learn so much, which is awesome.
That's amazing. So I saw you present at the Ehlers-Danlos Society and online a while back. Because as a patient, I always try to advocate for other patients to educate themselves, which I do. Yeah. And I was so impressed. And that's why I'm like fangirl. And I'm like, I found you on Facebook after, and that's when it all started. But, so it's
thank you.
You're on our show and we're talking to you. It's amazing. But anyway, I wanted to see if you have any advice for other physical therapists or healthcare workers to expand their knowledge and better understand the physiological aspect of hypermobility. Because so this question is kind of more for people in the medical field, healthcare workers, just to kind of expand and learn more. Because I think for the most part, they don't know a whole lot about it. Some people have never even heard of Ehlers-Danlos Syndrome.
Oh, I know. Yes.
They just think but you're a little flexible. Cool.
I know. Over here, and I'm sure you have it over there, that we're told that hypermobility doesn't cause pain. So what are you complaining about? It's all in your head, just get on with things, which is sad. So yes, my advice, first and foremost, is listen to your patients. When someone comes into your clinic or your surgery or wherever, take the time to actually listen to what they're saying. The old saying about don't look for zebras. If you hear hoofbeats, don't look for a zebra. It's going to be a horse. And it really isn't. So, listen to them because the patient knows really what's going on. And so that would be the first thing. If you could just listen, that would change so many people's lives. Even if you can't solve the problem and you can't fix it, we're not asking you to fix us, but we're asking to be listened to and not dismissed, because being dismissed year after year after year can be really demoralizing, demotivating, and, for some people depressing. And we want to stop that. We need to stop that downward spiral. So listen. And even when you send off for blood tests and they have scans and they come back normal, and you just say, well, everything's normal, there's nothing wrong with you, please don't shut the door then. Dig deeper. Why does everything look normal and yet your patient is complaining of pain, digestive issues, palpitations, migraines, all that whole host of things we know. So, that would be my first piece of advice, is just to please listen. And then, we're lucky that we have resources are starting to get better now. So the EDS Society, who, like you say, I speak for, they have so much information on their website, so many webinars from leading experts in every modality. And they have this amazing EDS Echo program, which I don't know if you've heard of, but it's totally free. And you can do it in Europe, in America, and I think they have it in Asia. And, a weekly hour, you go on, you hear from experts, you can ask questions, you look at case studies. It's absolutely amazing. So if there's anyone out there who's thinking they would like to know more about EDS, EDS Society, EDS Awareness, which is another group in America, I think they've got educational programs that are free for physicians and doctors. Over here in the UK, we've got the HMSA, EDS UK. So there is stuff out there if people really want to know. So yeah, first listen and then expand your knowledge, go and look at some of these, it's on YouTube, it's free. It's all free. I don't think we're trying to keep it a secret anymore. We're putting it out there for free. And all these amazing doctors are giving away all this information because we all have the same aim, is that we want to spread awareness, just like you guys are spreading awareness. So I think, that would be my advice to anyone listening. And really grateful to anyone listening who does want to expand their knowledge, because we need more people.
Absolutely. And so for my other part of the question is for the patient. What do you suggest for a patient, say they're going to see a physical therapist, and that maybe that physical therapist probably, we're going to assume, hasn't heard of Ehlers-Danlos Syndrome. Do you have any suggestions when they go in and have that first appointment? Should they bring material? Should they inform them? How should they go about that?
Yeah. I mean, a lot of people find it really useful, and a lot of people come to see me with typed information. They come in, and that is really useful, because if they can get it to me before the session. So say you're seeing a physical therapist next week. So if you've got something typed up or handwritten, try and get it to them before and say, look, I'm seeing you next week. I just wanted to give you this, to give you a little bit of background about where I am right now. Because at least then if they take the time to look at it, they're not just going to be going in blind. So they're going to start thinking, oh, well, why does she have this and this and this and this? And tell them, give them the website. If you want more information about my condition, look at EDS Society, look at this, look at that. Don't be afraid. I think a lot of us are kind of afraid, because we are afraid that people are just going to go, oh, I've never heard of it, and, you'll be fine. And so it kind of makes us, I think we have to be vocal, in a nice way, obviously, not in an aggressive way, but, be polite and say, here's my info. Could you take a look at it before our appointment? And also when you're in the appointment, if something doesn't feel right, tell them. If they're saying do 100 reps of this exercise for your legs, and you're saying, actually, that really hurts my hip. And they say, just push through the pain. Never push through the pain. Never, ever push through pain, because your body is saying it's not ready to do 100 reps of whatever you've been asked to do. So don't be afraid to speak out. Hopefully that helps. But it's tricky. It's a stressful thing when you go and see a new therapist, because it's like, are they going to believe me? Are they going to help me? But be prepared. Go with your information. I know the EDS Society have got leaflets, I think you can print off. There are information sheets. Take that in and say, have you heard of this condition? Because this is what I've got. If it's fibromyalgia, whatever it is, take them the sheet and say, are you willing to learn about it? I'm happy to be a guinea pig to a certain extent. If you're willing to learn about me and my condition, and then maybe you can get a nice relationship going on, a balanced relationship, not them telling you what to do. You're also helping them learn about this. It's a fascinating condition. I know it's painful and it has all its comorbidities, but it's also fascinating. For me as a practitioner, before I even knew I had it, and I was working for so many years without knowing that I even had it, I was fascinated. How could all these different body parts be affected? And wow, that impacts that, and this person gets this. It's really, for them, it's a great learning opportunity. So you can educate, the patient can educate the doctor or the therapist. So it's great.
Yeah, I love that. Because we talk a lot about that on our channel, about it's a two-way street, just like any other relationship. And so
exactly,
you want to build it, but you can only build with someone willing to work with you.
Yeah, exactly.
So if you hit that roadblock, we say it's okay to fire that practitioner.
Exactly. Absolutely. Yeah. Don't be afraid to walk away. If someone says, oh, I haven't got time for that. No, we're doing it this way. this is how we do it here, and you're doing it this way, you can say, bye-bye, I'm going to find someone else, actually. Absolutely fine to do that. You don't have to stay there if you don't feel comfortable. Remember, so much of us getting better is about feeling safe and secure. And if someone's saying to you, nah, go on, push yourself, don't worry, you're not going to feel safe. So just walk away. Absolutely, I agree with you.
I love that. Now, you had mentioned before you've written some books, so tell our listeners how they can find you and learn more about you.
And the Zebra Club.
And the
Zebra Club. Yeah, so yes, I have got a lot of information out there. So I have, as you mentioned at the beginning, I've got 2 books, Pilates Without Tears and Hypermobility Without Tears. So Pilates Without Tears talks about how I modify Pilates and really goes into detail into my integral movement method. And Hypermobility Without Tears is really about how I treat hypermobile patients and the specific program for them. So we go through my stages of my hypermobility program. The Zebra Club is an online program. I've got about 80 classes at the moment into different categories like stability, pain management, fatigue, sleep, mindfulness. And so people can log on and they can pick and choose a class that suits them on any different day. And they're all graded, so gentle up to challenging. And we've just actually introduced, because of popular demand from members, safe cardio classes. That's one of the things that people were missing, is that ability to exercise and increase their heart rate safely. So I've just filmed and released a load of those.
Wow.
Yeah, so lots of information on my website, which is jeanniedibon.com, and YouTube. I just want to mention my YouTube channel because every Thursday at 5 o'clock, I release a new video with either a tip or an exercise. Then, they're short little snippets, 5 minutes long, that you can just consume, because a lot of people obviously brain fog, etc. But you can consume 1 5-minute video, try an exercise, and they're all in different, seated tips, standing tips, elbow pain, knee pain, all sorts of things. So yes, I'm very active on all those channels, Instagram, Facebook. So people can find me one way or the other. But yeah, and I'd love to connect with people. So yeah, thank you for letting me mention those.
No, and we'll absolutely have everything linked for our listeners on our platforms as well.
Oh, thank you.
We want everybody to know about what you do, and thank you so much for taking the time to talk to us.
Oh, well, thank you. I loved it. It was lovely meeting you as well, and chatting
nice
with
to meet
you.
Our website, we'll share a blog post. So for those of you watching or listening, if you want to remember what the book was or check out the YouTube channel, we'll have all those links on our website.
Fantastic. Thank you so much.
Thank you guys for listening, and as always, we ask that you leave us a 5-star review on whatever platform you're listening to.
Also, make sure you are following us on Instagram and Facebook for the latest updates, and subscribe to our website where you'll find all the details from today's podcast, as well as other amazing resources. Don't forget to check out our latest issue of the Invisible Diaries magazine.
We hope you enjoyed this episode, and if you want to share your story or be featured as a Spoonie Spotlight, you can apply on our website, theinvisibleidiaries.com. Bye!